Hi guys, quick video. It's Nurse Williams here. Listen, I just want to talk about something really serious, and it's about the importance of healthcare, about becoming knowledgeable, having compassion, and communication. Whether you are a healthcare provider or a patient, there's no better historian. There's no one better to tell you how they feel than the patient and their families. I think sometimes we as healthcare providers we get caught up on what we think we know, what we've studied, what we've researched, and we think that that's adequate enough to properly give a patient a diagnosis or properly tell them what their plan of care is going to be. And that may be true on certain occasions, but I think we forget to listen. We forget to listen to the patient, what they're experiencing. We forget to listen to the families, and we forget that not every patient is the same. Not every symptom is going to present the same. So you can't treat everybody. You can't diagnose everybody the same. You have to do more research. You have to do more communicating. And if you don't know, you have to yourself even go find, the answers from another colleague or another, higher up person. We can't just diagnose people at the basic level because this is what their the normal signs and symptoms are. Especially when it comes to complex medical conditions. I think that a lot of healthcare providers, and this is not every healthcare provider because I've worked with some amazing doctors who really listen and they enjoy getting input from the nurses, but then there are some other ones who don't, and they treat patients based off of their knowledge. And I think everybody forgets that doctors are still practicing. No matter if you've been practicing 10 years, 100 years, or just 1 year, we're still practicing nurses. We're not perfect. We're still practicing, whether we've been in the nursing field 1 year, 10 years, or 100 years. We're not perfect, but we forget that families and patients are the great historian. It doesn't matter if you agree with what they're saying. It doesn't matter if you like what they're saying. You have to listen, get the history, get the backdrop before you adequately diagnose a patient or before you give them a treatment plan. Every treatment does not work for the same patient. Every treatment does not work for the same condition. Sometimes someone can have an underlying medical condition, and that certain treatment that will work for one patient will interact with another patient because they have another complex medical condition. Anyway, I say all this to say this. If you're a patient, it is great. It is purposeful for you to become knowledgeable about your medical condition, for you to research, for you to find out the appropriate treatment plans, for you to, ask questions from reliable resources. As a healthcare provider or healthcare professional, nurse, doctor, CNA, whatever your title may be, it's important for you to exemplify compassion, care to each patient that you have, and have the understanding that we're all in this together. We're all in this to help people in the community, and that we don't know everything, and we have to listen, and we have to share and have compassion each and every time we come in contact with a patient. It's their lives that we have in our hands, and we don't want to misdiagnose. We don't want to brush off or throw anything off to the side because we don't agree. I say all that just to say we got to start taking care of each other. The world is going crazy minute by minute, and we need more healthcare providers with compassion, knowledge, and understanding, which is why I post a lot about, encouragement and stuff like that, because you have to encourage people in order for positive, things to happen. Everybody needs encouragement every once in a while, and it can be your healthcare provider, it can be your patients, whatever. So I want you guys to continue to keep that in mind if you are in healthcare, or if you're a patient, or if you're thinking about becoming in healthcare. Just keep those qualities, and we'll be okay. But I just want you guys just to know, just to remember to treat everybody with care, compassion, and respect. All right, bye guys.